I'm Sophie Jenkins. This is my head-to-toe assessment for NURS7102 with Dr. Perry. It is October the 22nd, and it is the fall 2025 semester. This is my patient, Kurt. And we'll go ahead and start by scanning the record. So we'll go ahead and start by inspecting the skin. So the color is normal for ethnicity, the temperature is warm, texture is smooth, moisture is dry, skin turgor is intact, there is no edema, no lesions, no scarring, no bruising, or no nevi. We'll go ahead and move on to the head inspecting. The hair is a natural brown color, the texture is fine, and it is evenly distributed, so we'll go ahead and palpate the head. There are no depressions, masses, tenderness, signs of infestation, or lesions. So we'll go ahead and palpate the head and neck lymph nodes. We'll start with the pre-auricular, post-auricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. There is no tenderness noted, so we'll go ahead and palpate the temporal arteries. Alright, they are 2+ equal bilaterally. So we'll go ahead and look at the ears. So on inspection, they are symmetric in their position and alignment. So now we'll go ahead and assess cranial nerve number 8. The vestibular cochlear nerve. We're going to start with the whisper test. I'm going to come behind you and close one side of your ear. If you'll just repeat back the words I'm saying.
Pink, orange, green, apple.
Alright, so whisper test is normal. Now we're going to go ahead and do the Weber test. I'm going to get my tuning fork. And I'll have it make a noise. I'm going to place it in the middle of your head. If you'll let me know if the sound is louder on the right, left, or equal in both ears.
Cool.
Alright, now the Weber test is normal with no lateralization. Now we're going to go ahead and do the Renee's test. I'm going to do 2 sounds. The first one will be on your mastoid. Let me know when you're not hearing that anymore, and then I will move it, and let me know when you don't hear that second sound anymore as well. Alright. Alright, the Renee's test is normal. Air conduction is greater than bone conduction. So cranial nerve number 8 is intact. Now we will go ahead and palpate the ears. We're going to palpate the pinnae and tragus. There are no masses or tenderness noted. So we'll go ahead and do an otoscopic exam. We're going to look in the ear. The auditory canal is clear. The tympanic membrane is a pearly gray. Auditory canal is clear. Tympanic membrane is a pearly gray. So we will go ahead and look at the eyes. So with the eyes, we're going to be inspecting the eyebrows and eyelashes and the palpable fissures. So hair is distributed evenly and the facial features are symmetrical. So we're going to look at your eyes now. Look up. Sclera is white. Conjunctiva is pink. There are no lesions, redness, or discharge noted. So now we're going to go ahead and assess cranial nerve number 2, the optic nerve. We're going to do this first by looking at gross visual acuity. So I'm going to grab the Snellen chart. If you will cover your right eye and read the bottom line.
LTFPH.
Alright, other eye.
LTFPH.
Good. Gross visual acuity is intact. Now we're going to look at peripheral and central vision. If you will cover one eye, let me know how many fingers I'm holding up.
2, 1, 2, 1, 2.
Alright, other eye.
2, 1,
central and peripheral vision is intact, so cranial nerve number 2 is intact. We're going to move on to cranial nerve number 3, the oculomotor nerve. To assess this, we're going to use the pen light. I'll have you just look forward. I'm going to shine this light into your eyes. Alright, pupils are round, reactive to light, and 3 millimeters bilaterally. Cranial nerve number 3 is intact. Now we're going to assess for convergence and accommodation. If you will just follow the object towards your face. Accommodation and convergence is normal. Now we're going to look at cranial nerve number 3, oculomotor, trochlear, and cranial nerve number 6, abducens. So to do this, I'm going to have you, we're going to look at extraocular movements and the 6 cardinal fields of gaze. So if you will follow my finger with your eyes only, don't move your head. Alright, extraocular movements were coordinated and symmetrical, so cranial nerves number 3, 4, and 6 are intact. And we're going to go ahead and do an ophthalmoscopic exam. We are going to be looking for red light reflex and looking at the internal structures of the eye. So just look forward. Alright. Red light reflex is present in both eyes. The retinal arteries and veins show no signs of narrowing. They are normal in size, no hemorrhaging. There was no discharge or lesions noted. And the optic nerve has sharp margins. Now we're going to look at the nose. So inspecting the nose is midline and straight. So we're going to go ahead and assess cranial nerve number 1, the olfactory nerve. I'll have you shut your eyes. You're going to feel me close one side of your nostrils. Take a deep breath. What do you smell? Okay, same other side. What do you smell? Good. So cranial nerve number 1 is intact. Now we're going to quickly look in the nares to assess for patency. Alright, the nares are bilaterally patent. Now we're going to look at the mouth and the throat. We're going to be looking at the lips, the teeth, the gums, the buccal mucosa, the tongue, the floor of the mouth, the tonsils, posterior pharynx, and the salivary glands. So I'll have you open your mouth, stick your tongue out, move it left, right, lift it up. Good. So all of the structures in the mouth are normal. Tonsils are grade 1. Buccal mucosa is pink and moist. There are no obvious signs of dental abnormalities, no gum disease, no lesions. So we will go ahead and move on to the neck. Actually, we're going to go ahead and assess for cranial nerve number 9, the glossopharyngeal, number 10, vagus nerve. If you will go ahead and stick your tongue out and say ah. Alright, soft palate and uvula row symmetrically, so cranial nerve number 9 and 10 are intact. We're going to look at cranial nerve number 12, the hypoglossal nerve. If you'll stick your tongue out, move it left, right, up, down. Good. The movements were symmetrical with no fasciculation, so cranial nerve number 12 is intact. Now we're going to go ahead and move on to the neck. So the neck on inspection is supple and midline. Now we're going to palpate the trachea. Trachea is midline. Now we're going to go ahead and try to palpate for the thyroid. I'm going to shift your trachea left, swallow. Alright, shift it right, swallow. Alright, the thyroid is non-palpable. There are no nodules or enlargement noted. Now we're going to go ahead and assess the carotid pulses. Alright, they are 2+ equal bilaterally. Now we'll listen for any bruits. No bruits noted. So now we will look at the posterior chest, or the posterior chest. So I'll have you go ahead and turn around. We're looking for signs and symptoms of respiratory distress on inspection. There is no nasal flaring, use of accessory muscles, tachypnea, cyanosis, or retractions. And the chest is symmetric, no obvious deformities. So we'll go ahead and palpate for chest expansion. Take a deep breath. Good. Chest expansion is symmetrical, so we'll go ahead and palpate for tactile firmitis. Please say 99 with each touch.
99, 99, 99, 99.
Good. Vibrations are equal throughout. So now we'll percuss the lung fields and the intercostal spaces. Alright, resonance is noted throughout, so we'll go ahead and auscultate the lung fields. Take a deep breath with each touch. Alright, all lung fields are clear. We're going to assess for bronching. Please say E with each touch.
E, 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 E.
Alright, good. Agophony is negative. We'll assess for bronchophony now, so please say 99 with each touch.
99, 99, 99, 99, 99, 99, 99, 99, 99.
Bronchophony is negative. We'll go ahead and assess for whisper pectroliquid. Please whisper 99 with each touch. Whisper pectroliquid is negative. So I'll have you go ahead and turn around. We're going to be looking at the anterior chest now. So first, on inspection, it is symmetrical, no obvious deformities. We'll go ahead and palpate for chest expansion. Take a deep breath in. Okay, chest rise was symmetrical. Now we will palpate for tactile firmitis. Please say 99 with each touch.
99, 99, 99, 99.
Good, vibrations were equal throughout. Now we will go ahead and auscultate in the lung fields. Take a deep breath with each touch. Good, all lung fields are clear, so we'll go ahead and we're going to move into the heart. We're going to listen to each heart area with the bell and the diaphragm of the stethoscope. We're going to start with the aorta in the second intercostal space, right mid-sternal border. Then go to the pulmonic valve in the left mid-sternal border, second intercostal space. Erb's point, third intercostal space, left sternal border. Tricuspid, fourth intercostal space, left sternal border. And then the mitral in the fifth intercostal space, left mid-clavicular line, which also serves as our point of maximal intensity. So we're going to palpate there. All right, we're going to flip it over and use the bell. Aortic, pulmonic, Erb's, tricuspid, and mitral. All right, S1 and S2 heard no extra heart sounds, murmurs or gallops, no abnormal pulsations at the PMI. And now we're going to go ahead and auscultate the apical pulse for 1 full minute. All right, heart rate is 73, normal sinus rhythm. So I will have you go ahead and lay back now with your head at a 30-degree angle. We're going to be looking at the jugular vein, at the sternocleidomastoid muscle. We're going to inspect and palpate. There are no abnormal pulsations to palpation or inspection, no jugular vein distension. I'll have you go ahead and lay flat. We're going to be inspecting the chest area for any lifts or lifts over the auscultation points for the heart. I don't see any. So now we're going to go ahead and palpate in each heart area: aortic, pulmonic, Erb's point, tricuspid, and mitral. No thrills. So we're going to go ahead and listen again with the diaphragm and the bell with the patient in the supine position. Aortic, pulmonic, Erb's point, tricuspid, mitral. aortic, pulmonic, Erb's point, tricuspid, mitral. There are no extra heart sounds. S1 and S2 are heard, no murmurs or gallops, no bruits. We're going to go ahead and listen to the aorta with the bell, the renal arteries, iliac arteries, femoral arteries. No bruits noted. So we're going to go ahead and move into our abdominal assessment. We're going to start by listening to the vowel sounds in all four quadrants, starting with the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Vowel sounds are normoactive in all four quadrants. So now we're going to go ahead and percuss the abdomen. Take a deep breath and hold it. Alright, resonance was noted throughout. Resonance was noted over the spleen and dullness over the liver. Tympany was noted over all four quadrants as well as the spleen and dullness over the liver. Now we're going to go ahead and palpate the abdomen in all four quadrants. We're also going to try to palpate for the liver and the spleen. Alright, there is no tenderness or masses on palpation. The liver and spleen are non-palpable, which is normal. So now I'll have you go ahead and sit up with your back facing the camera. We're going to assess for CVA tenderness. Please let me know if this is tender at all.
No.
Alright, good. No CVA tenderness. You can go ahead and turn around. We're going to move into the musculoskeletal portion of the exam. We're going to start by looking at the upper extremities. We're going to be looking at the hands, wrists, elbows, and shoulders. So on inspection, there is no edema. They're all symmetrical, no redness. So we're going to go ahead and palpate all of the joints. All right, no crepitus, edema, or tenderness noted on palpation. We're going to go ahead and assess capillary refill in the fingers. All right, less than 3 seconds bilaterally. We'll now look at the radial bowls, palpate it. All right, 2+ bilaterally. Now we're going to go ahead and look at the range of motion, starting with the fingers. If you'll mimic my movement, okay? Flexion, extension, hyperextension, abduction, adduction, thumb opposition. Good. Normal range of motion in the hands bilaterally. We'll go ahead and look at the wrists. So repeat after me. Flexion, extension, hyperextension, ulnar deviation, radial deviation, and rotation. Good. Range of motion is normal at the wrist. We'll go ahead and look at the elbows. So if you'll repeat after me, this position, flexion, extension, hyperextension. Good. Elbows have normal range of motion. We're going to look at the shoulders. So flexion, extension, hyperextension, internal rotation, external rotation, abduction, adduction, and then circumduction. Good. Range of motion in the shoulders is normal. Now we'll go ahead and assess grip strength or strength in the upper extremities. We'll start with grip strength. Please grip my hands as hard as possible. Okay, grip strength 5 out of 5. If you'll put your arms up like this, resist my pull, resist my push. All right, bicep, tricep strength 5 out of 5. If you'll go ahead and raise your arms laterally and resist my push, resist my pull. Shoulder girdle is 5 out of 5 on strength. We'll go ahead and assess cranial nerve number 11, the accessory nerve. If you will shrug your shoulders against my resistance, good. So cranial nerve number 11 is intact. We're going to go ahead and assess for cerebellar coordination. So we're going to do a series of 3 tests. We're going to start with serial finger opposition. If you will repeat after me. Back, other hand, touch each finger to your thumb back. Good. Now we will do the hand flip-flop. Start with your hands prone, then supine and flip. Good. Now we'll go ahead and do finger to finger. If you will touch your right finger to your nose and then to my finger. Keep going. Good. Good. Other hand. elevation is intact. We're gonna go ahead and look at stereognosis. To do so, I'm gonna have you close your eyes, stick out one hand, and if you can identify the object.
Clock.
Good. Stick out your other hand, keep your eyes closed. Identify the object.
Paperclip.
Good. Stereognosis is intact. I'll have you keep your eyes closed. We're gonna assess graphesthesia. Stick out one hand. Alright, what letter am I writing?
G.
Good. Other hand.
H.
Good. Graphesthesia is intact. Now we're gonna go ahead and assess the light touch sensation. Keep your eyes closed. Just let me know where you feel me touching you.
Right arm. Left arm. Right arm. Right leg. Left leg.
Good. Light touch sensation is intact. Now we're gonna go ahead and use this tool. Keep your eyes closed. We're gonna assess the wrist first. Let me know if you feel the vibrating sensation.
Yes. Yes.
Alright, we're gonna do the proximal ulnar prominence.
Yes. Yes.
Good. And now the medial malleolus.
Yes. Yes.
Good. Vibratory sensation is intact. Now we're gonna go ahead and assess the deep tendon reflexes. If you'll just put your arms in neutral position. First, we're gonna do the brachioradialis. Alright. Alright, the bicep. Triceps. Alright, the patellar. Alright, and the Achilles. Alright, and now we'll do the Babinski reflex. Good. All deep tendon reflexes are normal and intact. We'll go ahead and look at the general appearance of the upper and lower extremities. The color is normal for ethnicity. The temperature of all extremities are warm. There's no edema and skin is intact. Now we will go ahead and move on to the lower extremities. So we're going to be looking at the toes, ankles, knees, and hips. So on inspection, there is no redness, swelling, or obvious deformities. They're symmetrical. We're going to go ahead and palpate. Good. No crepitus, tenderness, or swelling noted on palpation. Now we're going to assess capillary refill in each toe. Good. Capillary refill is less than 3 seconds bilaterally. We're going to look at the dorsus pedis pulse, 2+ bilateral, and now the post-tibial pulse, 2+ bilaterally. Now we're going to look at the range of motion in the toes, so if you can mimic my movements. Alright, we're going to do flexion, extension, hyperextension, adduction, abduction, adduction. Good. Range of motion in the toes is normal. We're going to do the ankles. Repeat your movements after me. Flexion, dorsiflexion, plantar flexion, rotation, eversion, inversion. Good. Range of motion is normal in the ankles. Now we're going to go ahead and look at strength of the ankles. So if you can just push your toes up, resist my push, resist my pull. Ankle strength is 5 out of 5. We're going to go ahead and do knee strength. So if you can resist my pull, resist my push. Knee strength is 5 out of 5. I'll have you stand up. We're going to look at the hips and the knees. So repeat after me. We're going to look at range of motion in the hips. Right leg, flexion, extension, hyperextension. All right, circumduction, internal rotation, external rotation, abduction, adduction. Good. Other side, flexion, extension, hyperextension, circumduction, internal rotation, external rotation, abduction, adduction. Good. Hips have normal range of motion bilaterally. We'll do the knees. All right, flexion, extension, hyperextension. Good. Other leg, flexion, extension, hyperextension. Good. Normal range of motion in the knees. I'll have you go ahead and turn around. We're going to assess the spine. No obvious deformities. Everything is symmetrical. Let me know if you feel any tenderness. All right, go ahead and hinge at the hips. All right, Shoulder blades stay symmetric. There's no sign of scoliosis or kyphosis. We're going to go ahead and assess range of motion of the spine. This is flexion, please stand, extension, hyperextension, lateral flexion, rotation. Lumbar spine has normal range of motion. We're going to do the cervical spine. If you'll look down, flexion, look up, extension, hyperextension. All right, lateral flexion, and rotate. Good, normal range of motion in the spine. All right, so if you will go ahead, face this way. We're gonna have you raise your arms up. Good, no swing noted. Go ahead and walk towards me. Now walk back. Steady gait noted. If you'll come this way, look at the camera, hop on one foot. And then other leg. Good. That concludes our head to toe assessment.